Welcome back to News Talk here on TBD. Good to have you with us this day. Later in the program, we'll talk live with the Reverend Jesse Jackson about the midterm elections, the economy, and NPR's decision to fire Juan Williams. Your calls and your emails included. Right now, though, back to our debate on the proposed ambulance fee in Montgomery County. With us, Assistant Fire Chief Scott Graham and Councilman Phil Andrews. Let's open the phone lines now so you can join our discussion and our debate ahead of the November 2nd referendum. Whatever your view, if you have questions you'd like answered, great forum for you to pose them. Join us by calling 703-387-1020. As always, we'll go to the phones as your questions and comments come in. I'm curious about the, before I ask my question, did I interrupt either of you at any point? Was there any loose ends that you wanted to
I was going to mention one other thing. I think the context in which this amount of money is being considered needs to be pointed out, that the $12.5 to $13 million in anticipated ambulance fee revenues is 1/300th of what the county appropriates to county budgets each year for the agencies. And so we are not talking about a big percent of money. And while the county executive...
You know the old joke, millions and millions, someday it adds up.
I'm not saying it's nothing. I'm saying that it can be met without cutting into essential services. The county executive proposed laying off dozens of firefighters if this is not approved. The county council is not going to approve that.
Do you think that's a scare tactic?
Yes, I do, because it's not necessary to do that. And none of the money in this fiscal year was dedicated by the law to the fire service. That doesn't occur until after this fiscal year.
Do you want to defend the suggestion of cuts the executives made?
The cuts are not an idle threat. They're not a scare tactic. They're a reality. And whether it's $14 million in fire rescue, a portion of that in fire rescue, there are other county services, county agencies that, let's take social services, let's take health and human services. If there's a child that's being abused and we don't have a caseworker for that child, then that, again, is a vital service. All services in county government are vital services. This money was included in the fiscal year 11 budget. A cut to any service in Montgomery County right now is critical. We have people that depend on all of our services. So to find $14 million, unless we're saying, okay, we're going to appropriate $14 million right now to fire rescue to meet all these needs, the money is just not there.
Phil?
Money is tight, but not all services are of the same priority. And what we have to do as a council, and what we have done, is to make the hard choices. We have protected public safety to a very large degree in these budgets, as well as education. And we have made cuts, much deeper cuts, in other departments, like the Recreation Department and Park and Planning, which took cuts in the 15 to 25% range. So we do make choices, and public safety and education have been at the top, and vital health and human services that protect the very most vulnerable people. Those are the services the county council has protected.
Is there more of a middle ground here than has been pursued so far? And here's what I'm thinking. If insurance companies are willing to reimburse for ambulance rides, and that money is not being collected by Montgomery County in a difficult budget environment, the case can be made that you should come up with a way to go for that money. But by the same token, those who cannot pay, whether they're county residents or not, it's nice to think that an ambulance ride in an emergency is one of those core government services that people have always gotten, quote unquote, and expect, and so we should try to preserve the status quo there. Is there more of a middle ground than is being discussed?
Well, you just said it. Everybody will be taken to the hospital that calls 911 regardless.
What if I'm a non-county resident
who's
not poor?
Mm-hmm.
I'm a relatively well-to-do, middle income, let's say, Prince Georgian, and I'm in Rockville because I work there, and I need an ambulance.
Well, if you're a well-to-do Prince Georgian in Montgomery County or Prince George's County, Prince George's will bill you as well. Okay? The fact of the matter is, the soft compassionate billing policies will send a bill at 30 days, 60 days, 90 days, and then drop. So if you have the means to pay it and you choose not to, we have factored that into our revenue projections. We are looking at a 60% collection rate, when in reality, other jurisdictions around us with similar socioeconomics are on about a 72% collection rate. So those who do not have the means, those are the people that we worry about. They call 911, they will be transported to the hospital, they will never hear from fire rescue service, they will never hear from a billing company as it relates to taking somebody to collections. As it is today, as I said earlier, November 3rd will be the same. I'll show up as your paramedic, I will treat you, transport you, and that is the end of the deal as it relates to fire rescue. The billing company will bill your insurance companies, Medicare, Medicaid. If you have no insurance, There will be no bill as far as a collections process.
Did you want to respond to my premise or thought?
Well, yes, I think it's still problematic because, number one, people are, not going to know in most cases about the hardship waiver. That's the sort of information that doesn't get out to people. And second, a lot of middle-income people would be subject to the bill because the hardship waiver is not going to protect a lot of people who are middle-income people for whom a $600 or $800 ambulance bill is a significant amount of money.
Mm-hmm.
And so we have more uninsured people, we have more people who would get a bill, and we shouldn't resort to this. We don't need to resort to this, and I don't think the county should resort to chasing ambulances.
I'm curious why the volunteers have so much energy around this issue. I can understand opposing it philosophically, lobbying, trying to tweak it, amend it, whatever. But there's a lot of energy here, and to me, that suggests something that's not part of the public debate. Now, one county official, high-ranking, told me that the volunteers wanted 38% of the money that came in, and when they were rebuffed, they turned and became enemies of this referendum. What's going on here? Why so much energy on the part of the volunteers?
The financial difference is, and they have stated this publicly, is it will inhibit their fundraising efforts. Again, the same research that we have done with the reduction in 911 calls or the hesitance in 911 calls, we've gone to jurisdictions that are much more robust with volunteers than Montgomery County and close to us. Frederick County, Maryland, they testified in favor of this. They have carnivals, they have dinners that do their fundraising efforts. They also have ambulance fees, and it has not inhibited their fundraising abilities at all. That's one of the concerns. You know, we have one volunteer corporation in Montgomery County that is a very robust. It is a model of volunteerism, and that's the Bethesda Chevy Chase Rescue Squad. With the exception of 2 paid paramedics from Montgomery County government, they fundraise for everything they have, their buildings, their equipment. Other than that, Montgomery County government pays the fuel, the maintenance, the utilities, and the capital improvements, purchase of the equipment for the rest of the volunteer corporations and provides them staffing. So the financial piece of it to the volunteers is that it would inhibit their fundraising. Again, we have proven that to be not true.
Do you want to respond to the issue that I raised about why so much energy on the part of the volunteers, Phil?
I think most of the volunteers oppose ambulance fees because they don't believe in them. And we heard in the interview one volunteer talking about how it made a difference in how the woman he was helping viewed the service, that she didn't want to take the ambulance if it was going to cost, and he was able to tell her no. We have an amazing volunteer service in Montgomery County. It's one of the strongest in the country, and it's continuing to grow, which is going against the national trend.
Was money part of what got them out there on this in such an intensely passionate way?
I don't know. I'm not in those discussions. I don't know what was promised by who or what was said by what. But I do know volunteers think it's wrong for the county to charge for services they provide for free, and I agree with them.
Voters will decide this issue on November 2nd. Phil Andrews, member of the Montgomery County Council, Democrat from District 3, that's Rockville and Gaithersburg. Scott Graham is the Assistant Fire Chief. Good conversation. I think we've helped educate the public today. Thank you very much for your time.
Thank you,
to speak with us.